There you go, friends. That was quinoa salad. And quinoa is a whole grain that is high in protein, good carbs, and fiber. So you have, if you were to make this salad, then you have a whole dish. You have your protein, carbohydrates, you have your vegetables, you have good fats. So don't hesitate to try something new, especially if you want to reduce your risk for breast cancer. What do you have to say, Dr. Daly?
I agree with Dr. Cooper. I have to try to go to that vegan-based diet, but I'm working on it.
Good.
But, just this has been great, providing this information. And there are several questions that were asked that I just want to address. There's one that I saw a friend asking about small breasts. Small breasts are mammogramable.
Exactly.
It may hurt a little bit, probably just as bad as big breasts. But it's important, and it's actually they're easier to check because they're smaller and there's less dense tissue to go through. So it's still very important whether you have small breasts. I mean, it hurts, just get beyond the thought of the pain. It's very important that small breasts, big breasts, medium breasts all have mammograms. When the mammogram, sometimes when the results come back, people get kind of nervous. You get a letter saying, follow up with your doctor. That leads to anxiety, but a lot of times, it's just to make sure that there's nothing there. It doesn't mean that there's something bad. Sometimes you just need additional views, just to spread the tissue out a little bit, compress a particular area where they may see some calcification. It may just be that the tissue is packed, piled on top of fibrous tissue or cystic tissue, and there's nothing there. So just don't be afraid. Just go get it done. And if there's something bad, of course, it's better earlier than later. Okay.
Right.
So just don't be scared about going for the mammogram and then go in for the follow-up. I have patients who heard that they were supposed to come back and they just assume that they have cancer and they just don't come back.
Right.
But that's not proactive.
Very good. And patients who have breast cysts are usually benign. So don't get anxious and nervous that you have cancer when the doctor says you have a cyst and we have to repeat a sonogram in 3 or 6 months. We're just doing that to make sure that there are no changes in the cystic lesion. So don't hesitate. We want you to go out there, ladies, and get your mammogram done. So follow through. Age 40 and above, you need a mammogram, whether it's yearly or every 2 years. Less than 40, if you have any breast lump, any breast pain, any discharge, any nipple retraction, you must see your doctor.
Any redness.
And of course, any skin changes. And husbands, help your wife with to know her anatomy. So if you feel anything different in the breast, just encourage her to see her physician. Ladies, you should not be anxious for anything. You have a great and wonderful God above. He created our bodies. He is the master healer, and He will strengthen you. So if you're anxious, if you're out there and you were told you have breast cancer, and you don't know what to do, keep watching us, because this month, the entire, every Sunday for this month, I will be discussing different aspects of breast cancer. I will have an oncology on the show with me. I'll also have a lifestyle doctor who will discuss with you how you can improve lifestyle and therefore decrease your risk for breast cancer. Find us online, Facebook, YouTube, or my website. And if you're in the local area of the Rio Grande Valley, you can find Dr. Daly. She has her office right here. Where's your office, Dr. Daly?
It's called Womankind OBGYN, and we're located at 1200 East Ridge Road, Suite 3 in McAllen.
Right, and I have 3 offices here, 1 in Edinburgh and 2 in McAllen. And if you're watching us online, we have seen people from Jamaica, from England, from all over. Find me online if you need to learn how to change lifestyle habits. I have online courses. Find me on my website and learn how to empower yourself to take charge of your health and to live a happy, healthier, and longer life.